without that objectivity, then how do we begin to address? How do we address these? I guess these behaviors or these feelings, or I don't want to even use the word disorders anymore because of the conversations we've had. But how do we address some of these symptoms without categorizing them? How do we? What is treatment? What does treatment look like under your perception of trauma and pathology, I guess?
Yeah, so obviously, as you just said, my concern would be the pathologization of that person and that person's experiences. So my concern would be, we've got this very traumatized person or very distressed person, they're going through these things and they're saying, I don't know, if we get some examples, so I'm having nightmares, I don't want to be here anymore, I feel low every single day, I can't motivate myself, I'm frightened to go outside, I've stopped talking to my friends, I don't see the point in anything, whereas maybe a medical model would be like, this person has clinical depression. My response to that, being anti-pathology and being trauma-informed, would be like, hang on a minute, why is this person feeling like this? What happened? What has gone on that has left them feeling this way? Who is around them? What's their environment like? How have they been treated? And what has left them feeling this way? And what are we going to do about it? So in terms of like, what does treatment look like under an anti-pathology model? It looks like whatever that person actually needs.